Hey, hey, let me get myself together. Hope you all are having a good start to the week. And I'm excited for this topic. Let me get Dr. Lanier in the house. As you can see, I'm in the man cave tonight. We've been booked and busy today, so I couldn't get home, but sometimes it's good to change up the set. Let's see. Here we go. Let's see. There we go.
Got it?
Got it. Cool.
Uh,
Yes, 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 yes.
How you doing?
I'm good. As you can see, I'm still in the man cave. We've been booked and busy today,
Good.
so I had to bring my ring light into the building today because I was like, I don't know if I'm gonna be able to make it back home in time, but all is well. What about you? Did you have a good
Yeah,
weekend?
I had a great weekend. I'm actually I just got back in town. I was out of town over the weekend and had a really good time. So thinking, so I was in.
Indeed. Did you bar crawl this St. Patrick's
Yeah,
Day? You get your bar crawl
I didn't
on?
park. I got my green on though, so I at least did that. But nah,
Enjoy
it
your
was kind
green.
of low key weekend. But what I was staying in a hotel. And I try to be good when I'm on the road. So I was like, oh, I got to make sure I work out and do something. But I forgot my shoes, my normal workout shoes that I normally wear.
Okay.
I was like, what I'm gonna do? I can't do cardio and stuff in the shoes that I have because I was trying to pack light. And so I just had to change it up. Did a little bit more like cross training weights, not as much cardio. Still to get my little work.
Mm-hmm.
So sometimes you got to pivot, make sure your feet still good, but still gotta make sure you're working out and doing your stuff. So I was just thinking about, I was like, next time though, gotta make sure I bring my workout shoes.
Good for you for not just totally ditching the workout. Because some people would have been like, well, whatever. I'll be walking around. So they would have just substituted the steps in. But we are back with another 10 Toes Down segment. Of course, I'm your favorite pedicurist, Sheena Pickett, owner and operator of Alpha Male Nail Care, giving the best pedicures for men in the city and one day around the country. And we have our favorite podiatrist, Dr. Lanier of Elevate Foot Doctor. And we are here to get into some March Madness. I love this time of the year. I am an ACC fan. They hosted the ACC tournament here in Charlotte. Watched a lot of them. Shout out to Duke. I'm not a Duke fan, but they are a Carolina team, so I appreciate that. So shout out to Duke for taking, I think both men and women
Mm-hmm.
won the championship. So ready for the NCAA. You got your brackets ready?
I got them out. I got them out. Got to put a men and a women. So I'm ready.
Mm-hmm. You ready? I have never done brackets before, so I'm interested. I might try it. I might do it. I think it's too late. Or is that
No, you can still
selection
do it.
Sunday is the only
No,
time? It's still
you
good.
can do it up
Okay.
to like tomorrow. Wednesday. Yeah, you still can do it.
I got some time.
Yeah, go and get your brackets filled out.
I need to get them done. Okay,
Yeah.
yes, you have challenged me, and I'm going to do it. Like I feel like I'm just going to be guessing, like most people guess, and then fake it till you make it.
That's that's who gets it right though. The people who
The
guess
ones that don't
has the
know.
best brackets. So that's
Yes, indeed. But tonight we're going to talk about March Madness and how foot health how foot health does affect your performance on and off the court. I'm super excited to get into this topic. I really would like to really dive into it. One thing, because I'm all about the stats. Basketball players put a lot of stress on their feet from sprinting, jumping, pivoting, going from side to side. And according to ChatGPT, I'm NCAA and NBA injury reports indicate that foot and ankle injuries account for over 25% of all basketball related injuries. So, Dr. Lanier, what are the most common foot injuries that most basketball players see?
yeah. So by far are ankle sprains. So you know, every time a basketball player is lacing up their shoes and getting ready to put it out on the court, you got to talk to them about stabilizing that they're playing basketball and also making sure that they have the right insoles and inserts in their shoes. So now with all the technology that we have certain insoles that we can recommend to our basketball players that will help resist them twisting their ankles. And one really good example, is kind of Steph Curry. If you kind of notice how the shoes he wears, and he wears ankle braces on both of his ankles because he's had severe ankle sprains. He's had surgeries on his ankles, and so it's so common that we see basketball players get ankle sprains. I mean, just recently during the ACC tournament, Cooper Flag, he's the most highly recruited, or I should say, going to go first probably in this upcoming NBA draft, and he had a really bad ankle sprain over the weekend. I mean, if you watch the replay, it's hard to watch the replays, but the side of his ankle touched, the floor, and so something like that, it really makes a difference in the seating. I mean, I think on yesterday, was Selection Sunday. His injury played a huge role, or was going to play a huge role, into where Duke got seated, and they actually came out with a kind of a press release and said, "Hey, Cooper Flag is going to be ready to play. He's gonna be in the NCAA tournament to make sure Duke had that highest seed that they could get." And so ankle sprains, they play a significant role in athletes, and especially basketball players.
Yes, I mean, I don't know. I'm outside looking in, but one day I would like to infiltrate the basketball players, the NBA locker rooms, and the NFL locker rooms, and really is there an emphasis put on taking better care of your feet and your hands, and doing those routine ankle exercises and things? Because I don't think I don't know, or is there an emphasis on teaching them how to strengthen their ankles, like that little point between the leg and the ankle, the foot and the, I guess, where your leg is, that joint is very important, and it's one of the, I think, probably very weak points, especially with athletes moving left and right and doing all the activities that they do. I'm not a basketball player, but I'm a tennis player, and those lateral movements are definitely play a part in having strong ankles. So you described ankle sprains, and like we said, 45% of basketball player injury are the most frequent injury is ankle sprains. Would you talk to us about what is plantar fasciitis? Because that is the second most leading cause of injuries for athletes.
Did you say plantar fasciitis? You kind of broke up a little bit.
Yes.
Yeah, yeah. So plantar fasciitis is basically an inflammation in the ligament that's on the bottom of your foot. The reason why
Okay.
you have plantar fascia is to help support your arch when you're walking, when you're standing, when you play in sports. So with all of the loading that goes into the foot with basketball, that particular tissue can become really strained. And then it becomes inflamed. And then if it continues to happen, it can kind of start to have degenerative changes in it. And so a lot of athletes will start to have heel pain, they'll have arch pain. And just kind of how you were alluding to, a lot of ways that you could prevent that is through proper stretching, is wearing the proper shoe, wearing the proper insert, and making sure that you have, the proper, training and running and resting and things of that nature. And so I do believe that, our trainers for various teams, they have a good beat on it. They know now that players can't just go 100% every day. They know that they have to have a cycle where they're resting well. And so it's really good to see that there is kind of coming full circle where we're not having our athletes, hopefully doing sports all. You
Yeah.
have to recover. And that's really the key to preventing these devastating injuries like plantar fasciitis or an ankle sprain or even something like turf toe. You can have that in basketball as well, or stress fracture. And so we really have to make sure that we're taking care of our athletes and sometimes even protect them from themselves a little bit, because athletes, they want to go out there on the
Go,
floor.
go, go, go.
And if, they're hurt a little bit, they may say, oh, it's not that bad. But, we in the
Mm-hmm.
trainers, the doctors, sometimes we have to say, hey, let's sit out this game, let's sit out this practice, let's do some treatment to make sure you're at your full capacity to play your sport at the highest level.
Yes. So, how long does it take for a person to recover from an ankle sprain or plantar fasciitis? I mean, we know that it does affect your ranking. It can affect what number you go into the draft. It can affect, your money at the end of the day. So it be the little things that make a big difference. So how long do you give an athlete, how much time does it take to heal from ankle sprain or plantar fasciitis?
It really depends. So ankle sprains can be either mild, moderate, or severe. And so generally, if you have a mild ankle sprain where you don't tear the ligament a week or two, where they're out of the sport, they get some treatment, and then they're ready to go again. But if you go all the way to a severe ankle sprain where you may have torn a ligament, that can keep you out for several months. And it really depends on which ligament was torn and exactly what happened. That could even sometimes lead to surgery. So if you're talking about surgery where you're repairing a torn ligament, you're talking about months for the athlete to be out. It's a pretty wide range from, if it's just a little strain to it, a week or two, all the way up to if it's a torn ligament, you're talking about months. And for plantar fasciitis, the big thing with that is that it can be recurrent. And so a player
Okay.
can heal or arch pain, then days later they're fine, but they're aggravated. So sometimes even if the player is feeling better, you still have to give it 2 and 3 weeks just to let that tissue really recover. And then once it's recovered, they're starting to slowly get back on the court. Then you can kind of just let them go free. And so you really want to protect the tissue so that it fully recovers, so that it doesn't become an injury that continues to bother the athlete.
So I'm thinking of MB, like he is like taped up.
Yeah.
Does tape really help? Like when they're rapping and rapping and rapping and rapping, like does that really help? Like what is that tape doing?
Yeah, so a lot of it is like kinesio tape. And so let's
Okay.
take for an ankle, for instance. So they're wrapping that tape and it helps to stabilize the joint, just like you were saying that an ankle joint can be very wobbly sometimes, for lack of better
Okay.
words. So they tape it up, and that tape is in direct contact with the skin and kind of direct contact with the underlying structures, and it really stabilizes, sometimes even better than a brace can. And so that's why they're taping like that, just so they can stabilize
Okay.
that structure, and it makes the player so they're not going to have that subjective feeling also that their ankle is going to turn when they're playing.
Okay. Last week you had mentioned the use of Botox. Does Botox help? Like the injections or anything? Can
So
that some type of injection help? Like what goes on behind the scenes? Like even though an athlete isn't 100%, what are some tricks of the trade that podiatrists do to, get the player on the court quicker than maybe they should?
well, so first and foremost, we're going to try to do everything to protect them. You always got to think about
Mm.
the longevity of the career. And so, we don't want to take shortcuts. I don't want to, give them like a cortisone injection to kind of cover up the pain and then have them go out. Back in the day, that was kind of the thing to do, right? So, a player has an injury, give them a shot of something. It kind of, masks the pain, covers it up, and let them go back out there and play. But we really don't want to do that because in the long run, you're loading structures that are already compromised. And so you want to make sure those structures are okay, and you're not going to send them back out there to injure them more. Now there are some things that we can do that are more biologic. It helps the tissue recover faster and doesn't cover up the pain. So there's a lot of biological injections that you can use. Some of them are called like PRP, platelet-rich plasma, or
Okay.
amniotic injections that incorporate, kind of like stem cells for
Stem
kind of,
cells. Okay.
yeah, and that kind of helps the player to recover better. Or there are just treatments that can be done by a physical therapist, for example, e-stim that can help to kind of stimulate the muscles to do better. And so there are certain tricks that we can do to try to help the body recover faster. But I always tell my athletes, like, a lot of times you just got to let your body do its thing. We can help it along, but you don't want to
Yeah.
rush and get back on the field. You're going to compromise your career on down the road.
Absolutely. Because they be wanting to
Yep.
play, and it be like, you got like right now we're in almost playoffs for the NBA,
Mm-hmm.
and they want everybody. I mean, LeBron is sitting on the
Yep.
bench right now. Luckily, they got your boy to kind of pick up some of that slack, but it'd be like too close for you to be getting injured
Yep.
during this time. So, thank you for that. What did I want to say? So we always talk about footwear is usually the most important thing when it comes to foot health. And so how what does the study show that over 70% of players wear shoes that don't fit correctly, leading to blisters, black toenails, and instability. So going back to it, we always talk about footwear. How important is shoe selection to prevent injury? Is there a thing like is high tops? Like, is that a thing to really protect your ankles?
Yeah, I still recommend shoes that are higher. You know, kind of the new thing in basketball are kind of wearing lower shoes because a lot of basketball players feel a little bit more free. They cut better, they're allowed to have a lower top shoe, but you trade that for stability. And so even though the lower shoe will allow you maybe better lateral movement, you just got to know if you have that lateral, then your ankle could turn a little bit easier. So a lot of times, you do the taping to maybe because a lot of times with a brace or a high top shoe, they just don't feel right. They feel it affects their game. So you put a lower top shoe with maybe some taping, and then that can make them feel a little bit better. But that you want to make sure is that the shoes are fitting appropriately, and this is for even if you're just going on a walk. You want to make sure that shoe is fitting appropriately. We kind of alluded to earlier. I always tell people to take the insole out, put their put their foot on the insole, and make sure they have about a half an inch between their big toe and the end of that insole to make sure they have proper shoe fitting. Because if they don't, and they're running up and down that court, their big toe, their second toe is hitting up against the shoe, then you can start to get, what we call sublingual hematomas, that blood underneath the nail, and just various injuries. Even something as simple as an ingrown toenail, they'll get. And that'll change their gait. That'll change their running pattern. They're not as explosive. And sometimes you wonder, you'll see a game with an athlete and they're like, they're just not right. And it could be something as small as, hey, they have an ingrown nail or got one removed, and that's kind of how they lost that little step. And so, those little things really matter, especially if you're on the elite level, right? So, I mean,
Right.
there's a really, really, small, difference between, these players just having, the right shoe size. That's going to give them a little bit of a better step than their opponent. And that could be, the difference between winning and losing.
Wow. So also like I used to like I have this poster of Michael Jordan in a pair of Converse, and before he got a Nike deal, does the thickness of a sole matter? thick soles versus a thin sole. Like when you see runners, they're like those shoes that were like barefoot, kind of like they look like they were barefooted.
Mm-hmm.
Does those matter? Like, do they give you a better grip with a lower sole?
It can kind of the ties always change. Sometimes, there used to be a really big barefoot running movement. And so,
Mm,
people, again, that they're more mobile, that they're faster with, kind of a minimalist shoe is what we call it. So there's not a thick
okay.
sole. People almost feel like they can grip the ground better. But then sometimes it comes full circle, whereas like, no, we don't want minimalist. We want more support. And sometimes thicker sole, and athletes feel that they're better. It really depends on the athlete and it depends on the foot type. And so you can't say, you know, a thick sole is good for everybody in this sport, or a minimalist shoe is good for everybody in this sport. It really depends on muscle strength, muscle structure, foot structure, how really that person is going to perform.
Mm-hmm. Cool. Thank you for that. And last but certainly not least, what are you mentioned like regular, like the little things can make a difference between you getting the championship or you being an elite athlete and really being the best player that you can. So I definitely recommend trimming your toenails and making sure that they are neatly trimmed and groomed, not too short and not too long. There's like a little balance with that. You also, that helps to avoid your ingrown toenails, making sure that you have the proper size shoes, as well as making sure that you are keeping your feet dry, because you see a lot of athletes dealing with athlete's foot because of the moisture in the locker rooms and putting them in and out of the different shoes and sweat and all of those things. And I know in one of our earlier conversations we talked about, making sure that you're properly drying your feet, because those fungus infections and bacteria are breeding grounds in those dark tight spaces when it comes to your shoes. But what are some other things that you would recommend as far as the best treatments for athletes that are dealing with like reoccurring pain? When is the best time for them to, either there's some at home things they can do, or it's time to see a podiatrist?
Yeah, so if you're having recurrent pain, especially as an athlete, you need to get to your athletic trainer. You need, your doctor or someone who can actually see what's going on. Because again, with the sport that you're doing, you're loading those structures so much. And the reoccurrence of pain could be, a structure that's damaged. So it could be a torn tendon, it could be a torn ligament, it can be a stress fracture, it can be a number of things. And so what I tell all of my athletes, whether they're, on high school level, collegiate level, you need to get checked out. Something that you just want to play around with. Of course, you want to make sure you're on a treatment regimen where after, every, practice or after every game, you're making sure you're taking care of yourself, you're cooling down appropriately, you're icing appropriately, you're stretching appropriately and things of that nature. But if something is not getting better or is getting worse, nagging you, you got to see somebody. The first
Yeah.
place to start, if see your athletic trainer and see what they're thinking about it. And if, they can't figure it out, or if it needs something else, then you appropriate specialist.
Yes, I mean, we have all heard, or maybe you haven't heard about Deion Sanders, how he left, he kept playing and playing and playing and playing, and then eventually, he had, I think, turf toe
Mm-hmm.
was his issue, and he just wouldn't let it go, because athletes' mind, go go go, go hard, and now he has to get massages every day. Had some, I think, blood clots started happening, and he's had several toes amputated. So to all the athletes out there, please, as soon as you feel something, say something. If you see something, say
Right.
something and
Mm-hmm.
go immediately. You don't want to keep playing. Like, I'm sure it could have ended his career earlier. I mean, but after your career is over, like, most people are playing 5-10 years in the basketball league, but you have the rest of your life, and you don't want to be suffering from these injuries when you could have, reached out to someone a little earlier. And maybe you may have had to sit down a season, but one season compared to the rest of your life is minimum. What type of what is the best treatment? Like, what are some best treatments that you would recommend? Like, what are some, I guess, exercises, or you mentioned stretching? What kind of stretches or techniques can athletes do to help strengthen their ankles and the lower extremities?
Yeah, so I mean, there's a lot of stuff. There's TheraBand workouts that you can do that most athletes work with their athletic trainers with. You want to make sure you're strengthening all of the muscles. A lot of times, you work on the larger muscles, hamstrings, quads, but you want to make sure you're strengthening your calf muscles, even the smaller muscles in the foot. We call them the intrinsics, the muscles that you don't really think about. And those you can do with, a lot of toe curls and toe crunches, things that you may not think about. But if those muscles are stronger, they're going to build a stronger foundation so that you don't, turn your ankle or you hurt other structures like your quads or your hamstrings or that nature.
Yes. One thing, I wrote a book called Raw Footage, A Gentleman's Guide to Proper Foot Care. And one of the techniques that I wrote about strengthening your ankles is when you're sitting on the couch, and this is for anybody, you're sitting on the couch, spell the alphabet, like assume that you have a pencil between your toes and spell the write out the alphabets, like trace the alphabets using your foot, and that helps you to strengthen your ankles. And it hurts after a while, it hurts, but you're building up that muscle. And one thing I always hear, rice, would you break down the acronym of rice?
Yeah, for sure, for sure. So RICE, stands for rest, ice, compression, and elevation. So the R, rest, you are feeling something, some type of injury, you stop doing your sport. Sometimes you need to consult with someone exactly how long you need. You generally want to let rest, for at least 48 to 72 hours to let the structure, cool off and kind of reduce an inflammation. Then ice, coolness reduces inflammation. So you want to ice him. Compression, usually like an ace wrap. They have these, compression, like these copper sleeves now that, a lot of the athletes do. That compression helps to stabilize the area. Then elevation, that's just, usually elevating whatever, either lower extremity or upper extremity above the level of the heart to reduce the swelling, and that in turn can reduce inflammation as well as pain.
Indeed. And one last thing, does Epsom salt really work?
It's kind of, I tell my patients to soothe, but really have any medicinal. There's not really any high level studies to say that it does, but it doesn't hurt either. So I usually tell my patients to use Epsom salt, and most of them say that it seems to help.
It does. Okay, because our ancestors and tradition, like just soak your feet in Epsom salt, and that takes care of the swelling and the pain. But cool, good to get your opinion on that. Absolutely. So that's all that I have for tonight. Our another 10 Toes Down episode, and we tackle in March Madness. Looking forward to the games. Do you have any teams that you're keeping your eye
Of
out
course
on?
I do.
Okay.
I
Yes.
both of them, but I'm all about the women's. My Dawn Staley, my South Carolina Gamecocks. We got, the
Okay. Okay.
in our region, not the overall seed. I give shout out to UCLA. They got the overall seed. But this being, women's, month recognition.
Yeah.
And, I'm just giving a shout out to the South Carolina Gamecocks. I hope they do
Absolutely.
well in the tournament. That's my team. The Gamecocks, go Cox. So I'll be looking out for them for sure.
Indeed. So I just want some good basketball. I'm looking forward to seeing the girls. Like last year, we saw Caitlin Clark, we saw Angel Reese, and they made major waves, like you said, in the WNBA. So I'm looking forward to seeing what is the next up and coming ladies. I think, is it Flange? I think this might be her last season with LSU. And also, I'm looking forward to seeing Juju
you, Drew.
you. So I'm looking forward to seeing some of the ladies play. NC State, they did a really good job last year, so I'm looking forward to seeing a lot of the ACC teams in the NCAA. So I love March Madness, and I love that the ladies are definitely getting some play, getting some sponsorships, getting the TV time, and getting the credit that they deserve. So
Yep,
yeah, shout out to all the ladies. March Madness, Women's Month is this month, and we just excited to be a woman and being recognized. So that's all we have for today. Thank you again, Dr. Lanier. I love us having these conversations, and I hope that our audience is being able to take away some good pointers. And if you got any questions, please watch the replay and drop them in the chat.
for sure. We'll answer them. Yep, DM us. So for real. See you next week.
Peace.
All right.